Hi everybody, this is Dr. Ty Vincent making hopefully the last video where I'm going to talk about hydroxychloroquine and the use of it in COVID-19 patients and that respiratory illness. Hopefully it's the last time because there's some research finally coming out about it and it looks bad, not good and not even equivocal. So a study mentioned this week in the news that is coming out in the VA population, so veterans. Pretty homogenous group of people, probably older people. I haven't seen the demographics of the specific people that they had in the study. But it was put out this week, today being April 24th, 2020, just to orient you. And what they did was what's called a retrospective study. So they did not take two groups of people and start the study with all these people at the same time, half getting placebo, half getting hydroxychloroquine, and watching them over time. To speed up data gathering, sometimes you do what's called a retrospective study, and you use information from patients that you already have. So you can publish a research article right away instead of waiting to do something going forward in time. So it's retrospective, not prospective. That's one potential criticism of the study, okay? But they looked at veterans who had significant COVID-19 related illness, and there were 368 of them total, which is another potential criticism. It's not a huge number, but it's hundreds of people. It's enough to draw conclusions. And they looked at some who were given hydroxychloroquine alone, some who were given hydroxychloroquine plus azithromycin, and these had just been treatment decisions by their treating practitioners at the time. And then a group that had not been given either of those drugs through the course of their illness. And they looked at the main outcome being death. So in the number of people who were given neither of those drugs, the death rate was 11.4%. So if you just kind of treated them the conventional, typical way they were doing supportive care and whatnot, 11.4%, that's a little less than 1 out of 8 chance of dying. And then the people who were given hydroxychloroquine, either by itself or with azithromycin, if you pool those two numbers, there was a 24.3% chance of dying. So it more than doubled the death rate to give hydroxychloroquine, whether it was with or without azithromycin. Those who were given hydroxychloroquine alone actually showed a 27% mortality rate, and those who were given hydroxychloroquine plus azithromycin was 22 point something, or about 22%. So there's a little difference between those two. The azithromycin probably made no difference. It's just that it's a small sample size, so you get numbers that aren't that exact, right? But it more than doubled the chances of dying. And if you do the math, the difference between the pooled percentage of 24.3% death rate with hydroxychloroquine minus the chance of dying without the drug, which was 11.4%, you get a 12.9% difference. And the math there that's relevant is you can calculate what's called a number needed to harm, or in this case, a number needed to kill. And that number works out to about 8. So for 1 out of every 8 people doctors might choose to treat with hydroxychloroquine in this scenario might die because of the drug, because that's the only difference you're looking at here. So that's bad. Well, when I had done videos talking about hydroxychloroquine before, I was mentioning why the mechanism made no sense, why the use of the drug made no sense, and why the drug has potential toxicities and problems, and we don't really understand how it manipulates the immune system response. It may be good, it may not be good in this particular context because it hasn't been used this way. My hope was that it just wouldn't do any harm. And unfortunately, that's not the way it worked out. The drug definitely looks like it does harm. You know, if one more person out of every 8 ends up dying because you try this ridiculous, non-scientific approach, that's not acceptable. So hopefully we stop hearing about this. The whole notion had been propagated by certain, primetime news anchor type people, well, not really news, but people on primetime shows on Fox News and other conservative networks were promoting this for reasons I cannot fathom. And then the president picked it up because that's where he gets his information. My caution, I guess, to everybody in the public would be, please don't get your medical information from people like that who have no medical knowledge or understanding. That's an old fallacy of informal logic called argumentum ad verecundium, where you attribute some significance to someone who has some kind of authority in your mind, and you believe what they say, even though they're not an authority on that subject. It's a very common thing, and it's the basis of almost all advertising in America. You have a football player advertising homeowners insurance, for example. They're not an insurance agent. You shouldn't listen to them, okay? And if you have some news anchor, I don't care what network it's on, trying to tell you whether a treatment is or is not good for COVID-19, don't listen to them either. Listen to the medical people who actually have at least some understanding of how these things work. Or it might kill people. Yesterday's news conference, President Trump was talking about using disinfectants directly into the body, either by injection or drinking or something. And please, if you're out there and you tend to want to believe what the president says, don't. Not in this context, at least. Don't go drinking bleach. Don't go injecting bleach into your skin, under your skin, or drinking Lysol, or gargling with any other disinfectant, Mr. Clean. I don't care what it is. Those things will harm you and kill you. They're poisons. So let's get information from people who have an understanding of that information, and let's not listen to people in this context who don't have any understanding of that information, or bad things are more likely to happen than good things. So that's it for this, I hope. And I still plan to do a video about vaccines and the concept of a COVID-19 vaccine today as well, so look for that. Thanks.